Good morning, everyone, and almost good afternoon to some of our partners. Welcome. Before we get started, if you could add your name and your facility in chat, that would be wonderful. We always love to see familiar names. And we're going to get started in just a minute. Hi, Stephanie from Berkshire. Chelsea, hi. Toby, good to see you. And Cora, thank you for joining today. All right, it is 11 o'clock Mountain Time and noon Central Time, so we're going to get started. Welcome to our 30-minute session on Nursing Home Quality Essentials. My name is Rosanna Milanovic, and I'm a program specialist. Today, we have a unique session, and we're really excited to have our guest speaker, Stephanie Smith, and several of her peers from the Center of Excellence for Behavioral Health in Nursing Facilities, who will provide a program and website overview. We're just going to have some kind of housekeeping slides where please add QI Connect to your list of email contacts and check us out on Facebook and LinkedIn. And Television has our listserv for our nursing home partners. If you're not signed up, please use the QR code here and you can sign up. Being on the listserv means that you'll receive notifications, critical updates from Television, CMS, and CDC, and you will receive information about upcoming events and trainings. Also, you can engage in peer-to-peer sharing. So, for example, you could send a question and your peers in other nursing homes can reply based on their practices or tools that they use. Television has an assessment dashboard that organizes 5 assessments that help support you to identify any potential gaps in these areas. It's a great place to start, and then you have a quality improvement facilitator that can help you really prioritize the potential issues that you want to focus on based on your facility's needs. All right, let's get to the Center of Excellence for Behavioral Health in Nursing Facilities and learn more about their excellent program. Our guest speaker, Stephanie, has been a licensed clinical social worker since 2017 and has been working in the field of behavioral health and social work for 15 years. Stephanie has worked in several settings, including residential behavioral health, child welfare, the nonprofit sector, and medical social work. Stephanie is currently the regional behavioral specialist for Region 8, and this includes Colorado. And we have several of her teammates that are also regional behavioral specialists for our regions that cover Illinois, Iowa, and Oklahoma as well. And Stephanie is going to introduce her teammates and going to provide an overview of the website and program. And then we'll have time for also a Q&A. So Stephanie, I'm going to hand over the session to you.
Thank you so much. I'm going to go ahead and so I'm going to introduce my my colleagues or have them introduce themselves. Amber, would you like to go first?
Sure. Good morning and afternoon, everyone. My name is Amber Jennings, and I am the Regional Behavioral Specialist for Missouri, Iowa, Nebraska, and Kansas. I live in St. Louis, Missouri, so hi to my facilities that are in my region, and I can pass it over to either Amy or Crystal.
I'll go. I'm Crystal. I'm over Region 6. So Region 6 includes Texas, Oklahoma, New Mexico, Arkansas, and Louisiana. So nice to meet everybody.
Hey everybody, I'm Amy Reeder and I represent Region 5. I live in Southern Ohio. I represent Ohio, Indiana, Illinois, Michigan, Wisconsin, and Minnesota.
Wonderful, thanks team. And I'm going to go ahead and drop our contact info in the chat. All right. For those of you who don't know us yet, the Center of Excellence for Behavioral Health and Nursing Facilities, or as we like to call it, the CoE&F, is a free resource for nursing facilities. Everything we do is at no cost to nursing facilities. We aim to serve as a centralized hub for nursing facilities by expanding capacity and caring for residents with behavioral health and substance use conditions. We do this through trainings, certifications, resources, technical assistance, and workforce development. The CoE-NF was established by SAMHSA, or the Substance Abuse and Mental Health Services Administration, to meet the increasing behavioral health needs in nursing home residents. Alliant Health Solutions is the primary awardee of this grant, and they serve the eastern part of the U.S., and they've partnered with Comagin to serve the western part of the U.S. So the center is currently funded for a 3-year period, which started back in September 2022 and will continue through September 2025, with hopes that it extends longer. But since it's not guaranteed, I highly recommend reaching out to us sooner rather than later. We are specifically focused on areas of serious mental illness, substance use disorder, and co-occurring disorders, as well as behavioral health focused updates in nursing home guidance by CMS. Today, I'll be navigating through the features of our website to help you folks access all the resources and supports that we offer. Let me pull up and share my website. Let's see. Sorry, folks, this is taking a quick second. Share. There we go. All right. Can everyone see my website screen?
Yes, it looks good.
Perfect. Okay. So the first thing I would like to point out is this request support button right here. This is one way that you can connect with us directly, and it will automatically assign your request to the correct regional behavioral health specialist for your state. By filling out the information on this form, nursing facilities can request us to reach out to them. It asks for some basic contact info and a few specifics about the facility or agency you're from, and if there are any specific reasons that you're requesting support. These questions provide us a little background before we meet, but you don't need a specific reason or issue to reach out to your regional behavioral health specialist. A couple examples is you're looking for substance use resources or trainings or technical assistance, mental health training resources or technical assistance, general inquiry, or you would just like to meet with one of us. We receive inquiries for all kinds of reasons, including specific requests for resident situations to just those general inquiries. And we're happy to meet with any staff within a facility, whether they know the kind of support they're looking for or they're not quite sure yet. After you request support, the regional behavioral health specialist should reach out to you within the 24 to 48 hours, and they'll ask to schedule a virtual meeting. These are usually about 30 minutes. During these meetings, your regional behavioral health specialist will guide you through a conversation about your facility, what your team currently has in place, and any specific needs or requests that your facility has. After learning about your facility, they can offer guidance and recommendations based on that conversation. Next, I want to highlight the button to register for our newsletter, which is all the way down here at the bottom. We send our newsletter out through email about once a month. Our monthly newsletters have links to upcoming trainings. They talk about current and updated CMS guidance for nursing facilities, new resources and trainings that we've developed, and so much more. Also down here at the bottom of the page, you can register for our text list or follow us on any of our social media platforms. Next, we have our About Us page, which is up here at the top. This provides some good background about who we are, what we do, our leadership, and most recently, we've added the CoE-NF in Action tab, which highlights some of the specific situations that we've worked with nursing facilities on and how they've benefited from working with us. One of the most important part of our website is right here, this trainings link. This is where you can register for upcoming trainings, access any of our past trainings, and learn more about our office hours and behavioral health action network. This live trainings button right here brings you to a registration page for all of our upcoming trainings that you can register for. Most of our trainings on this calendar offer ACCME and NAB credit and are always free to attend. We have several new trainings every month. This month, we've partnered with AMDA to bring 2 new trainings, one on exploring options for pain management for patients with substance use disorder, and another for easing transitions of care for patients with serious mental illness. Another option we have on our calendar each month is mental health first aid certification and the question persuade refer suicide prevention certification. These certifications fill up fast on this national calendar, so I recommend registering as soon as you see it if you're interested. And if you're interested in getting multiple people from your facility trained, I highly recommend reaching out to your regional behavioral health specialist because they can help you schedule one specifically for your facility or team. Most months, we also have our foundational trainings on rotation in this calendar, things like our Substance Use 101 or Mental Health 101 with suicide prevention and de-escalation strategies. Again, if you're looking for a training that isn't on this calendar right here, contact your regional behavioral health specialist. We have smaller regional trainings that we have access to, but are not always posted on this national calendar. And you can always schedule some of those trainings specifically for your facility. So just reach out to us. One new addition to this website is training recordings and slides for past trainings. You can find that again under this trainings tab under training recordings. They're in the process currently of updating all the trainings that we've had and uploading both the recording and the slides here. So if you don't see the one you're looking for currently, they should be posted soon. For example, let's say you were interested in this person-centered care for nursing facilities. You just click it. And right here, you'll have access to those slides and that recording that you can access at any time. It's all on demand. We also have, under this tab, we have office hours. These are our monthly dates with subject matter experts for the CARE Serious Mental Illness certifications, and another one for the substance use disorder topic. And this is a great place to come and ask questions for those who are experts in the field. We have 2 really wonderful folks on that substance use disorder office hours that are really experts in their area. We also, within this training tab, we have the Behavioral Health Action Network, and this is a cohort learning series. We are currently in the middle of our 2nd series, and the next one is expected to start in early 2025. So if this type of thing is something you're interested in, you can come down here and request that we contact you when we open up our next cohort learning series. Another important note, if you have a topic or area that you need training or resources on and you don't see it listed here on our website, you don't see anything in the past, please reach out to us. All of our trainings and resources are created based on what we're hearing nursing facilities are saying that they need. So reach out to us. We're also able to schedule those trainings specifically for nursing facilities at no cost. For example, if a facility is interested in that Substance Use 101 training, we can meet with them, find a time that works on their schedule with their time. We'll coordinate with the subject matter expert and get it set up for that facility. So the next important place to know is this resource tab. This is where we keep all the resources that the Center of Excellence for Behavioral Health and Nursing Facilities has created. If you have something specific in mind, you can also narrow down by type. So if you're interested in like a flyer or a PDF, a video, or like a website link, you can also filter by categories. So if you have a specific topic or type of training, you can filter here. Within this section, you can also find some great tools, including several behavioral health screening tools, our comfort menu for residents, a facility-based behavioral needs assessment, and some rapid PDSA cycle tools for quality improvement. An insider tip, the most recently added resources, the ones that have been most recently created, are up at the top. So this Helping Residents with Anxiety was just released. To access them, you just click in, download resource document, and then everybody has access to download and print. So give some really good practical tools. Now, still under that same resource tab, we have news and announcements. This is where you can find all of our past newsletters. And this is a really great place to do a deeper dive into topics that are important to nursing facilities. We have some really great subject matter experts writing on these newsletters to dive deeper. Our July newsletter covered mental health disparities among minority communities for National Minority Mental Health Awareness Month, and discussed tag F740, prioritizing residents' behavioral health care and services. So they are worth going back through and checking into some of these deeper dives. Now, the last portion that I'll share is our on-demand learning section. It's right here. This is where you can access our on-demand trainings and podcasts. Our on-demand videos section has two different types of videos available. The first being our bite-sized learnings. These are 5 to 10 minute videos that touch on a variety of topics. We find these helpful when introducing topics to staff or when there's just very little time in the schedule to do longer trainings. We cover all types of topics, so schizophrenia and antipsychotics, power of empathy, which is really great when it comes to de-escalation, class, behavioral health equity. There are a lot of really great bite-sized learnings. And going a little slow, so hopefully it lets me. Okay. And then the second type of on-demand training, and it's a little further down that same page, is our modules. So these are a little bit longer and they're 15 to 20 minutes. They cover a variety of topics as well. And they have pre and post tests, which allow us to offer that ACCME credit for them. So as we come to kind of closing and where we're at on this website walkthrough, I wanted to encourage nursing facilities to reach out and connect with us. Our goal is to really meet with every facility across the nation and provide that individualized support. Folks are welcome to reach out to us directly through the website, through emails, or by phone. And this can be with a specific request or to just learn more about what might be helpful for your facility. Now with that, do we have any questions?
Nothing in chat yet, but please feel free. This portion of our session is Q&A. So if you have a general question about services or how the Center of Excellence can support your nursing home, please feel free to unmute. This is, we have our experts here, so this is a great time to ask those questions. And while we're getting everyone ready to mute, I'm looking forward to looking at that CoE and F in action, Stephanie. Can you tell me a little bit about what's in that and some kind of like the most common requests that you have, just so that everyone has an idea of why or when they would reach out to you?
Absolutely. Let me just share that page real quick while we're talking about it. Okay, so our CoE&F in action page is we submit different challenges that we're hearing from nursing facilities every month, just to kind of give a good example of how we're helping folks, what they can reach out to us for. So for example, this facility, their unique challenge was responding to someone exhibiting aggressive behavior is not a baseline skill for their staff, and they're really just hoping to increase their de-escalation strategies. So the solution was that their staff would, or the recommendation was that their staff complete the CPI verbal de-escalation training. And then the outcome or the benefit was that 14 of their staff were able to get trained on the CPI de-escalation. And then they became, ambassadors for this training, sharing it out to other staff. And it really just helped them to navigate some of those challenging behaviors with residents. So I would say we hear all the time that nursing facilities are really just looking for ways to support de-escalating residents. So we have several resources available on de-escalation specifically. We have the certification that we offer. And when we're meeting with residents, we really dig down on those issues. So is there a specific escalation, or was there a specific situation that a staff and a resident had, or a resident and a resident have, helping them look at the big picture and what kind of things, what were triggers and what was in place, and then making recommendations either staff-wide or specifically for that resident. So I would say that's de-escalation is one that we hear a lot.
Mm-hmm. Yeah, and I think that's something from the intelligent perspective that we hear too from our partners is aggressive behavior and how to address that. And your tools and your handouts are just a great place to start.
Yeah, I mean, it's a challenging thing. Absolutely.
Mm-hmm.
And some of my favorite resources on that, if anybody has some time to check them out, our de-escalation toolkit's really wonderful. The first part of it focuses on staff and how they're showing up to a situation. The second part of it focuses on creating specific things that a staff member can do to help de-escalate that situation. And then the last part is, I would say, just as important as the rest of it, is debriefing about the situation.
Mm-hmm.
So what factors were in play, really looking at it full picture and see if there's specific things that you could change moving forward to prevent that type of thing from happening. It's definitely a really great tool.
Perfect. And we have several questions in chat. Paige asks, or she just said, yes, their facility could really benefit. And Tamara asked, what are 3 things you wish partners knew about your services?
Oh, great question. I think our services, one really big thing, our services are no cost. Certifications that typically have a cost, like that mental health first aid or CPI verbal de-escalation, these are all things that we cover through our grant, and facilities can access and really get those certifications to become experts in that. And so I would say that's one really big thing. Amber, Amy, Crystal, do you guys have any other thoughts on what are a couple of big things that you wish they knew?
I always think, I think a lot of people don't realize that they can use our services in congruence with other things, because they'll say, oh, well, we already see, such and such entity. And so there's a lot of explaining as far as that goes, which is great. I don't mind explaining, but it's just one of those things I wish everyone, understood that they can use us too. We're just another resource.
I like that we have kind of a multimodal way of training. As Stephanie went through, we have some of the longer trainings where it's 5-hour training and receiving a certification, or we have something that we have a lot of our nursing facilities, in lieu of a team meeting, will say, hey, let's do this 1-hour mental health 101 training, and we can have that. Or you can have those bite-sized learnings that Stephanie highlighted, that's a quick 5 to 6 minute training, or resources that you're able to print out and use at your leisure. And so we have a variety of ways in which facilities can learn that can be tailored to them. It's not like you have to follow any training design that we have. You can use our resources and trainings to make it fit your facility and the staff that are there.
That's a great point, Amber. You just all of your trainings and resources and tools are very comprehensive to really individualize the needs of the facility. Lisa asked, what feedback have you received from nursing home staff that completed training like this? But I'm guessing maybe the de-escalation.
Usually we hear that it's a pretty good success, that they have fewer incidents of residents getting escalated or quicker recovery times when residents are getting escalated. So staff feel more empowered. I think that's some of the good responses that we hear back, is that they feel like they can step up and do what they need to do, and they have the information to do it.
Wonderful. I don't see anything else in chat. Anything else you'd like to highlight? Anything specific to any of our 4 states that you could think of?
Yeah, I would just say, anybody that wants to reach out to us, we are always open. And again, you don't have to have a specific reason. During those meetings, if you don't have a specific topic, we will lead those conversations and we will still provide you with some support. We will make it a valuable 20 to 30 minutes of your day.
Awesome. And Stephanie, if let's say someone submits that request, that there's just a resident that's having a really challenging time, would that be a good request to really help with maybe an individualized care plan, or how would you approach that?
Yeah, we can make individual recommendations. So for example, recently I had a facility who reached out to me for a resident who was cutting open his skin. He felt like he had bugs underneath his skin, and they just had no idea where to really go with him. So we talked about different recommendations of how to move forward, getting him assessed, and incorporating psychiatric services as well as counseling services, and educating staff around this. So it was any specific resident situations are really great. And we can always provide recommendations.
Perfect. Anyone else have a question for the team? We have a few more minutes if you'd like to unmute. All right. Well, we will close up. Please reach out to Center of Excellence if you have any questions, you need a specific resource. I am probably at your website a few times a week, and it's just really, really great trainings as well. If you have any questions, please reach out to our general inquiry email or our nursing home email. Don't miss out on our upcoming sessions. On Thursday, we have another guest speaker to discuss infection prevention and control and her quality improvement journey. On August 13th, Kristen, our subject matter expert, will have our NHSN office hours. And on the 15th, we're going to have some COVID-19 vaccine updates and resources. And as a reminder, please fill out the post-event questions. Once the session ends, it'll pop up in your browser. Thank you for participating in this session, and a huge thank you to the Center of Excellence for Behavioral Health for your essential work and support for nursing homes and residents. Your work is truly invaluable, and thank you so much. I hope everyone has a great day.
Thank you.
Thank you for having us.